Welcome everyone, we're gonna get started.
Yeah.
The energy in the room tonight is definitely different from the previous educational events that we've had on campus and also streaming live. We have friends here, we have family, we have current students, we have just graduated students, we have alumni 3 years back, and we also have a couple students that are interested in the program, both here on campus and online. So a big round of applause for everyone. So welcome to FPTI's Teach and Train event, the last one of 2022. So I am super excited because not only do we have friends, family, alumni, and current students, but we also have our very own alumni, Dr. Cara Pichardo, up here with me presenting and leading tonight's presentation on stronger bones and one of the leading diseases that we have in today's society known as osteoporosis.
Perfect. Thank you so much, Casey. Okay, so before we start talking about all the dense stuff that's going on with osteoporosis, we need to first begin with the basics, right? How the bone is structured and the important parts of it. So the bone is living tissue that makes up the body's skeleton. Within it, we have different bone tissues that are going to interact with each other, and these are the compact or cortical bone. This is the outer layer of the bone, is the thicker layer. This is going to make up for 75% of our skeleton. This is going to provide its bone strength and is going to be a very important attachment site for tendons and muscles. We also have an inner layer of the bones called spongy or trabecular bone. This is going to make up 25% of the body skeleton, and it's also going to be a large surface area for mineral exchange. Now, these tissues, like I mentioned, are going to be interacting with each other to try to maintain a healthy bone. So we have a process called bone remodeling. So what this is just the natural process in which bone is being constantly broken down and rebuilt. And this is thanks to two very important cells. We have osteoblasts and osteoclasts. I want you to think about, let's say, a construction site. Let's picture like these two workers that are building like a new road. So you have the one that's the builder and the one that has like jackhammers going to demolish the road, right? So one is in charge of breaking down that asphalt, and the other one is trying to build up new asphalt to make a better road, right? So these two workers have to be in constant balance. So one is breaking down, the other one's going to lay down more asphalt, so we have a very perfect smooth road. So when we have an imbalance between these two cells, meaning we have more breakdown than actual formation of the bone, that is going to lead to osteoporosis. Bones are going to get weak and it's going to be more prone to damage. This process, I know this looks like a lot, but I'm going to try and explain it. This process is very dependent on calcium. So our bodies are super picky, and they want to try to maintain homeostasis, or homeostasis also means like balance within its internal environment. So let's say an individual does not ingest enough calcium or has another pathology that's going to disrupt the balance in calcium within the body. We have some backup, meaning like hormones, they're going to interfere and try to maintain the normal balance in calcium. So we have parathyroid glands. These are 4 tiny little glands that are located in our thyroid, here in the neck area. And what they do is they're going to sense what's going on with calcium in the body. So let's say this person, again, does not ingest enough dairy products or enough calcium in their diet. These glands are going to send out this messenger called parathyroid hormone, or PTH. And this is going to be floating around the body, and it's going to be going towards the bone. It's going to be like, hey, bone, something's happening. This person's not eating well. Something's going on. I'm freaking out. So once it reaches the bone, the one that answers the door is the osteoblast. So the osteoblast is like, hey, I got you, don't worry. I'm going to send out some receptors and some reactions to try to keep everything back in balance. So osteoblasts are going to through a series of reactions and receptors, it's going to knock on the osteoclast door and going to be like, hey, osteoclast, we need to dig out some of the calcium that we have stored, so we need to send it back to the bloodstream so everything can go back to normal. So that's pretty much the function of our parathyroid gland. They're going to interact with the osteoblasts to try to maintain that level. But what happens? Sometimes the PTH and the osteoblasts are having way too much fun, and sometimes the calcium can go up way more than it should be. So now we have calcitonin. This is another hormone produced by the parafollicular cells, also located in our thyroid. So what calcitonin does is like the opposite of the PTH. So calcitonin comes in, is like, hey guys, I'm sorry to interrupt the party, but you're having way too much fun. Now calcium is way too high, and we need to do something about this. So calcitonin is like the opposite. It's going to inhibit that resorption, or that breaking down of the bone that was actually happening in the beginning. So to try to maintain everything back in normal. So this is a very tight process that needs to be very tightly regulated, so everything can be, within the ranges that it should be. Everything clear? Cool. So again, this is very important, so things can be the way it should be. But we also have other factors that are going to be affecting the bone remodeling, or that process of breaking down and building. We have vitamin D. One of the many, many actions that vitamin D has is it's going to increase or stimulate the absorption of calcium within the intestines, so they can be sent out to the bloodstream and levels can go maintain the normal range. And we also have mechanical stress. Casey's gonna talk about this later on, but we need to have enough physical activity in our daily lives, let's say walking upstairs. So that forces that are induced in the bodies, that's also going to lead to bone remodeling, because when we do those physical activities, those little cracks that happen in our bones, that's is going to activate the process of bone remodeling. So this is why it's also very important to keep physical activity going. Now, it's super important to keep this in mind because the bones are going to be very important for various reasons. The bones are the framework of our body. They help us through the skeleton to maintain posture, to keep us upright. It's going to be a huge protectant for organs. For example, our rib cage is going to protect lungs, the heart. For example, the skull is going to protect our brain. It's going to be super important to anchor muscles, and when muscles are going to excel that force, that's going to promote bone moving, right? So it's going to promote locomotion. Within the bone itself, we have the bone marrow. So this is a key important for blood cell production. And it's also going to be super, super important for storage of minerals, like calcium, like I previously explained, super important for the health of our bones. Now, a decline in bone health due to poor habits, lifestyle can lead to many diseases, but the number one health issue regarding to the bone is called osteoporosis. If we break down the bone, osteo meaning bone, porosis meaning porous. So this is described as a progressive metabolic bone disease in which bone mineral density is going to be decreased, or the bone mass itself, and it's going to lead to deterioration and bone fractures. So like we see here, this is what a healthy looking bone should be. And in this side, we have like that porosity happening, and that's where the bone is going to get weak and it's going to be more prone to fractures. This is a major public health concern because more than 10 million Americans have osteoporosis, and an additional 43 million people have low bone mass, which if we don't act on time is going to then lead to that weakness and more fractures and osteoporosis. This is usually called a silent disease because most of the time we don't really feel our bones getting weak. And usually, by the time of the diagnosis, it's because a fracture already happened. So that's when people usually seek help, and then, oh, surprise, you have osteoporosis. The population that would see this more often is in women. So 25% of women 65 and older have osteoporosis. More than 2 million osteoporosis-related fractures occur each year in this country, and more than 70% of this is going to occur in women. Hip fractures are the most serious consequence of postmenopausal osteoporosis. Women with hip fracture have an increased mortality rate of 12 to 20% during the subsequent 2 years. This is a very high number. What this means is after a fracture has occurred, the women has a 20 to 20% higher chances of mortality, meaning like dying after this injury. It has to be like injury-related diseases like infections, because they usually cannot go back to normal activities. They're going to be laid in bed for long periods of time, and they can also develop other diseases from this. How are we doing? You're still with me? Yeah? Okay, cool. I know, this is quite a bit, but we're trying to keep it like super simple. Again, what is osteoporosis? If we break down, osteo meaning bones, porosis, bones. Again, this is a higher breakdown happening in the bone in comparison to new formation of new bone. So this is going to increase the porosity of it, and it's going to make it weak. So like I mentioned earlier, there's osteoclast, osteoblast. So we see the breakdown, osteoclast, breaking down the bone, and when we have more of that happening instead of new formation, that is going to lead to weakness. This is how the normal bone should be. This is when we increase that porosity, and it's going to be leading to fractures. Now, this is the cross-section of a bone. There's a lot going on, so I just want you to focus on these two parts here, the cortical bone and the spongy bone. Like I mentioned earlier, those are two very critical portions of the bone. And what happens when we get the osteoporosis is, remember, when that osteoclast activity happens, we're going to have a thinning of the cortical bone, meaning the outer side layer, and we're going to have an increase in number and size of the trabeculae. The trabeculae are those little spaces that we see here that are within the spongy bone, which was the inner part of the bone. So again, what's going to happen? This is going to be thinner, and cortical bone is supposed to be the strong bone, so we have a thinning of this, and this is going to increase in size, and those spaces, that's what's going to give the porosity look of the bone, and that's why it's going to be weak and prone to fractures. The fractures that are more commonly seen in these patients are usually the vertebrae, thoracic and lumbar vertebrae here in our spine. Also the femoral neck. The femoral neck is the upper portion of your femur. And also the distal radius. Radius is one of the bones that make up our forearm. Those are the most common sites that we see these fractures. Now, the risk factors for this disease. Age is said to believe that osteoblasts are going to gradually decrease their ability to form new bone, while osteoclasts are going to keep doing their thing. So again, if we have more osteoclasts working instead of osteoblasts, this is going to lead to weak bones, and this is going to overtake, breakdown is going to overtake. So this usually happens around the 7th or 8th decade of life. Obesity. Obesity is a huge factor that plays a role in osteoporosis. Obesity is going to induce loss of bone, through a process called osteoclastogenesis. What this means is there's going to be a new formation and activation of osteoclast cells. So that state of obesity has been a pro-inflammatory process. So if we have more activation of osteoclasts, what's going to happen? More breakdown of the bone, right? So that's why obesity is very tight linked with osteoporosis. We have sedentary lifestyles. Again, like I mentioned briefly earlier, if we don't have enough physical activity happening in our bones, we're going to have weak bones. Casey's going to mention more about this later on. Low serum calcium levels, like I mentioned, this whole bone remodeling process is tightly regulated by calcium. So if the person is not ingesting enough or has other pathologies that are going to disrupt the calcium levels, is a huge, huge risk factor for calcium, for osteoporosis. And hormones, in this case, we're going to talk about estrogen, because again, we mentioned postmenopausal women who are in higher risk. When we get into a stage of menopause, this means that women have low estrogen levels. So estrogen is going to play a huge role in the bone resorption. It's going to inhibit that breaking down of bone. and it's going to have a direct impact on proliferation and activation of new osteoblasts. So when women get to that stage, meaning less estrogen, so we have the less protective measurements of estrogen working on osteoblasts, and osteoclasts are also going to take over. Super important that we keep all of these factors in mind, not only for ourselves, for our family members, for our clients. So it's really important that we take action. One of the ways that we have to diagnose this disease is called dual energy X-ray absorptiometry. Try saying that fast 10 times. So that's a tongue twist, right? So we just call it DEXA scan for short, right? Simpler. So as a DEXA scan, what this is pretty much like a fancy X-ray. It's usually done in the spine or in the hip, one of the hips. And this is going to compare the bone density levels in the body of the individual with a normal adult person of the same age. And the measurements are going to be in something called the T-score. This is a standard deviation. So from this comparison, the number that this is going to give us is a T-score. If we have less or equal to negative 2.5, this is going to be diagnostic of osteoporosis. And now, Mr. Casey is going to take over.
Thank you, Dr. Cara. Thank you. So let's review a little bit of what Dr. Cara mentioned. I'm going to try my best to match her ability to really break this down in a simplistic way. But let's take a step back all the way to the very beginning. It's imperative that we have strong bone. Now, we have many functions, right? Our structure, protecting our vital organs, being an attachment site for muscle, right? There's so many important reasons why our bones need to stay healthy. With that, there's a way our body can actually regenerate bone through two cells. This is the two cells that are like your construction workers that are going to build and break down bone, right? So if you guys remember, osteoclasts break down. They're like the jackhammer in the street. Osteoblasts are going to build, so they're going to repave that new road, right? So now on top of that, we see this disease, it's called the silent disease. Silent because you might not know you have some form of a disease until you fracture a bone, specifically areas like the lumbar spine, the total hip, and the femoral neck, like Dr. Cara mentioned before. So now, what can we do, right? How can we all leave tonight with something applicable that we can tell, teach, or coach someone, whether it's for exercise-related interventions or diet? So that is where I'm going to step in and talk a little bit about how diet and exercise can both play a critical role in keeping bone healthy, but also help manage osteoporosis if one was to be diagnosed. So now, a key word I want to point attention to is individualized. So some exercise might hurt someone while they might help another. So individualization is key here. And you'll see that as we go through. But something I want to point out, 85 to 90% of adult bone mass is going to be acquired in females around the age of 18 and males around the age of 20. So I'm going to repeat that. 85 to 90% of adult bone mass is mostly acquired, right, in the ages of 18 to 20. So now when I talk about prevention, this starts early. This starts 18, 20 years old, right, or even before then. We're going to see that shortly. So one thing to kind of take this to our next step here is something called peak bone mass. So again, thinking about when the bone is reaching its highest point, right, through adulthood, peak bone mass is happening at childhood into the early years of adolescence, right? This is really important stage. So who remembers the mineral that is a major storage site within the bone? Calcium. So it's imperative that we get in enough calcium with a vitamin called vitamin D, which we can get from the sun and other foods like egg yolks and things like that, that we combine those. And I'll talk about that shortly. But again, there's been numerous studies that show those with a higher peak bone mass in the adolescence, teenage, early adult years actually have a much greater or a much lower risk, I should say, of developing osteoporosis. So again, the prevention starts very early on. So let's talk about exercise, and I'm going to specifically go into something called exercise selection, because remember what I told you before. Some exercise might help one, but hurt another. So 2 types of exercise that are going to induce what's called mechanical stress. In simplicity, it causes stress, good stress, to the human body through physiological functions in the bone, right? So we can actually induce good stress, it's called EU stress, to our bone to really help elicit stronger bones and help have more of that promotion of osteoblast cells, the building or reformation of bone. The first type of exercise we're going to see here is weight-bearing exercise. So think about it, weight-bearing, where an exercise we can bear most of our weight. So something like running, walking, jogging, dancing. You should see my salsa moves, right? Even a little dancing can do well. My fiance sitting in the back is very happy about that one. Even stair climbing, right? This is going to elicit what's called compressional force. Think gravity. We want gravity to help us. So I would love for you to participate in this one short activity. Can everyone stand up? Stand on up. Okay. If your joints and bodies allow, maybe do a little stretch here. I know I hear some snap, crackle, pop. All right. What I want you to do, I'm going to demonstrate it first, and then you guys can follow suit. What I want you to do here is basically stand up on your tippy toes and let gravity bring your heels down to the ground. So stand up on your tippy toes, and now let gravity bring your weight down to the ground. That is compressional load, right? That's a weight-bearing mini activity where we are eliciting compressional load, okay? Now, please take a seat. I know it felt good to get up a little bit, right?
Awesome.
Now think of that as running, right? Or jogging, or salsa, right? Dancing a little bit, or even stair climbing. That action, that type of exercise can help elicit more of that osteoblast activation. Remember, osteoblast, building of bone. The second type is called tensile force. Now we see this with resistance training. So when you see tensile, maybe you think tension. As Dr. Kara mentioned earlier, muscle attaches to bone via tendons. So when a muscle contracts, it pulls on the tendon, which pulls on the bone. So think of these as, let's say, lifting weights, using dumbbells, or even your own body weight, right? Depending on who our client is and who our friend and family member is, maybe something as light as body weight squats will be just fine. Where others you might need a little bit more external load like a dumbbell, a kettlebell, or a barbell. But nonetheless, weight-bearing cardiorespiratory activities where we're going to see that compressional force, which you guys all did, right, alongside resistance training, which is going to allow for that tensile force, right, can all help build stronger bones. Now, Dr. Kara mentioned before, there's a few sites that we are going to see osteoporosis kick in. Our lumbar spine, our total pelvis, and our femoral neck. Now, we also see our wrist and our ankles get affected when osteoporosis really takes a strong suit over the body. So now, not only can those exercises help elicit osteoblasts and the reformation of stronger bones, there's also a few other goals that I'd like to share. When we exercise, we're also increasing overall strength. Now, let me go back to those area sites where we see osteoporosis. Lumbar spine, hip, right, ankles and wrists. If I have osteoporosis, maybe I don't know about it. Remember, it's a silent disease, and I fall. I don't have enough core strength. I don't have enough lower body strength, coordination or balance, and I fall. What's most likely going to happen if I have osteoporosis? It's going to fracture. It's going to break. We are trying to prevent that. So exercise is a really good treatment, if you will, or preventative tool for this condition, right? So like I said, improving posture, improving coordination, and balance are going to be key. Now, I want you to think outside the box. Okay, if you remember the prevalence and the population that's mainly targeted here, right, females and older adults greater than 65 years of age. What I want you to focus, and the huge takeaway from tonight, is thinking about exercises that can help what's called activities of daily living. So when thinking about weight-bearing exercises, maybe walking up the stairs. Maybe your client, friend, family member, maybe they walk to work and they got to walk up a flight of stairs in order to get to their office. Or maybe in their own house, in order to go down to the basement, right, they're going to have to come back up through, via stairs. If we can help this client, this friend or family member, increase their lower body strength, right, we can ultimately help them with their tasks that they do on an everyday basis. Because remember, if they don't have enough strength to lift their leg up and they trip and they fall, and they have osteoporosis, they don't have it yet, maybe they have something called osteopenia, we're now increasing the risk of fractures and things that are going to really increase mortality. The second thing, resistance training, thinking back to those tensile forces. So I love this picture up here on the screen, right? How can we choose exercises that are going to help with activities that we do on a day-to-day or weekly basis? So here's a great example, right? Picking up grocery bags, right? Very similar to the formation of a deadlift. Now, I wouldn't recommend going right into a barbell deadlift. Maybe you work on some hinging motions prior to. But as a progression, this is a great exercise selection because now we're hitting all of these check boxes, right? We're building stronger bones. We're building core strength. We're working on posture. We're working on lower body strength to really help this client or this family member. So thinking of hinge movements like the squat or even like the deadlift, or even squatting motions can really help increase the ability of this friend, family member, or client to live a longer and healthier lifestyle. So exercises to avoid. Those are great exercises. Remember what I said. Some exercises can really hurt certain conditions. High impact. So there's a little bit of ebb and flow here. Remember what I told you, something as simple as standing on your tippy toes and letting gravity bring you back down to earth, right? That's impact, compressional force. But too much impact can actually be problematic, right? Because again, these are fragile bones. So we need to make sure that we keep our exercise selection and intensity to a very nice point, low to very light, moderate in intensity. Also, if you remember one of those sites of osteoporosis in the spine, we want to avoid extreme flexion, extension, and rotation because of the compressional load. Think of a Pez dispenser, right? When you push back on the head of a Pez dispenser, right, the pressure goes back, and where does everything go? Forward, right? If I go into extreme extension or extreme flexion, we now run the risk of the bones in the back and the bones in the front of the spine touching each other and having a lot of compressional force. And lastly, like I mentioned earlier, any exercise that's going to increase your risk of falling. So like box jumps, I would probably stay away from. Even running, right? Because there's a lot of risk there for someone that has osteoporosis or osteopenia. So that's the exercise selection. That's the exercise intervention. And I hope you guys have a better understanding now of what types of exercises you can utilize to, again, prevent this. Remember, prevention happens very early on. Yeah. Very early on. Now let's talk about diet. So, as Nan mentioned earlier, right, calcium is stored within the bone. We need calcium for every muscle contraction in the human body. It's imperative that it's in the blood. We store most of our calcium in the bones. So if we're running low in the blood, our bodies can pull from the bone. Osteoclasts, the jackhammers taking away from bone, right? So let's talk about diet. Now again, critical in the early adolescent, young adulthood years that we should get in a sufficient amount of calcium. And I'll talk about some different sources of calcium in a minute. But we really want to aim for about 1,000 milligrams a day, and there's going to be a caveat to this rule. And these daily amounts can even increase to 1,200 milligrams a day once we get into older adult years, especially in women 50 and older. So here's my caveat. Vitamin D, remember we talked about earlier on. The absorption of calcium is highly dependent on vitamin D. They go hand in hand. So if you go to the doctors and they prescribe you maybe over-the-counter calcium, they're going to also provide you over-the-counter vitamin D because they go hand in hand. So now let's talk a little bit about natural ways that we can eat foods and products and gain more calcium within our diet. First one is pretty obvious, dairy products. So things like milk and cheese are going to have a high calcium, but also dark green leafy vegetables. So I know you guys are like, kale? Yeah, thanks. I'll stick to my pint of Ben & Jerry's ice cream for the calcium, right? Soy products such as tofu have a high calcium count. Even almonds have a pretty high calcium count. But also some cereals are going to have what's called calcium fortified cereals or juices, which are going to have that vitamin D and calcium combination in it as well. So from a dietary standpoint, this is a simple chart. I kind of just wanted to show you guys that these are the recommended dietary allowance for vitamin D. Again, this is all going to be specific to the person at hand. Now, because I have a doctor standing alongside me, no matter what, we need to get medical clearance in order to exercise and to apply these exercises and dietary recommendations that we've seen here tonight. It's really important that we do seek medical attention prior to. So let's take a big full circle here and talk a little bit about some important pieces of what we were presenting on tonight. It's really important that we have healthy bones, again, for all of those functions that are going to help us with activities of daily living and even into our adulthood for more independence as we get older. As I mentioned before, individualized exercise and diet plans can really help increase bone strength, prevent, and even manage osteoporosis. Again, as Dr. Kara said, screen often and screen early. Screen often and screen early. So the DEXA scan. The DEXA is a screen that you can actually identify whether or not your bones are getting weaker. Usually this happens post-menopause in females is when they'll start getting routine checkups every 2 years and thereafter. But as we mentioned, we want to make sure that we can educate the youth, the importance of exercise at a young age, the importance of having a well-balanced diet, getting in that calcium. If you're lactose intolerant, again, dark green leafy vegetables and nuts like almonds can really help. And it's not too late to start. So although a fracture in an older adult will lead a patient or an individual to identify that they had osteoporosis, it's not too late to start. So any exercise is going to be super beneficial to that person, to that client for a better, healthier life. All right. So on behalf of myself, Dr. Kara Pichardo, and all the Focus staff that are here tonight, both in person and online, thank you guys so much for a great event. And we'll be around, kind of walking around if you guys do have any further questions. Those online can actually meet with us directly by going to fpti.edu/meet. For those on campus, we'll hang tight and we'll talk to you guys. But thank you guys so much. Enjoy the rest of your night.